also, what's really interesting to me is that the lymphatic system doesn't, for what I read, doesn't have a pump like the heart, for example, and the blood system. So it depends on things like movement, exercising, muscle contraction, and therapies like the ones you offer to
Yes.
keep everything flowing,
And
right?
breathing. Breathing is our pump. So
Oh,
I
breathing as
do
well.
3 different techniques for breathing.
Okay.
You clasp your hands, put it on your chest, wrap your arms around there, and you're
Mhm.
going to breathe in through the nose to get the oxygen to the brain. And as you exhale, you're going to press your chest down and keep holding it down and then start to breathe in and then release. And that helps to fill in the upper lobes. You do that 4 times, and that starts to clear space for the blood to come back to the heart and the lungs to fill up and use your diaphragm. And then the other technique is that you hold your rib cage down, and as you exhale, you push all the air out of the lower lobes and keep holding the rib cage down, and then breathe in and keep hold the rib cage down. Exhale, squish it down, and breathe 3 times. And on that third breath, you're going to take a long, deep breath in and then let go and continue to expand. So, this is a technique that helps clear the lower lobes. And if someone has pneumonia, it helps to get the fluid out of the lungs to the lymph system that wrap around the rib cage. And then our third technique is by putting one hand over the navel and the other hand on top. You can, let's see if I can do this. You exhale, push all that air out, and then inhale, and then release, fill up, and you can do that 5 or 6 times. You can do it standing, laying down, sitting, anytime you think about it, but that gives your whole body a charge of the lymphatic system. Very
That's
simple
a
things.
replacement for pretty much a pump, right? I mean, and for those who are listening only and not watching, I was trying to keep up with all the techniques, and it feels great. So
So
thank you.
breathing is very important. Other things we do
So
is dry
interesting.
brushing. I could give a little pair of exfoliating gloves and you brush so the top of the hand comes up over to the top of the shoulder. The
Uh-huh.
palm of the hand drains to the elbow and then underneath the arm. So by doing light brushing before you hop in the shower is very powerful. So you go from the navel to the rib and you brush up in this direction to the armpits. And everything below that, you brush down to the inner thigh. And but
Mm.
the things they don't tell you on the internet is that you do not want to do this if you have an infection because you can
Okay.
spread the infection.
Right.
And infection could be a UTI. It could be an abscess tooth, sinus infection, ear infection, strep throat, things like that. Very important not to move the lymph around to the bloodstream because the lymph nodes are isolating that infection and the lymph nodes swell up with proliferation of lymphocytes to the area to dissolve and break down that infection. So it must be at least 3 days on antibiotics before you resume a daily care like that.
Well, thank you for giving us that tip and just a small summary for our listeners. Deep breathing is what it's your pump, and then number two, dry brushing, right? Which wakes up your lymph system, and just be very careful if you have an infection, and of course, consult with.
Your doctor. And also another one that we overlook is that if you're having dental cleaning, you do not want
Mhm.
to move this because they may be scraping the teeth of the bacteria and cutting the gums. And then the lymph nodes are isolating that bacteria so it doesn't damage the heart valve. So that's very important.